This video will go over IV push medication when your IV primary solution is not compatible with your medication. So it doesn't happen very often, but this patient is running Ringer's lactate and needs a Dilantin dose IV push. So first I'm going to make sure I've done all my checks prior to coming into the room, and I'll do my third check when I come into the room. So hand hygiene, introduce myself to my patient. Hi Luke, my name is Rhonda, I'm your nurse today. I have a medication for you, it's called Dilantin, and it's to prevent any seizures that you might be having. I'm just gonna verify your name and your FIN. So Bryson, good, and the FIN number matches the FIN number, or we could check the date of birth as well. We could also verify, can you tell me your first and last name? Luke Bryson, very good, thank you, and your date of birth. Perfect, thank you. So I've done my third check with the right patient. Now I'm gonna do my third check with my medication. So I'm gonna check I have the right medication in my hand, Dilantin matches my MAR. I will also check to make sure I have the right dosage, 100 milligrams, that's what I have in my syringe. It is due right now, the route is IV, so it is safe to give. I've done my checks. So I've also done my patient education as well. So I think we are good to give this. I've checked my PDM and it's told me that this is not compatible. It actually doesn't specify if it's compatible with Ringer's lactate. It says compatible in normal saline, incompatible with dextrose, heparin, insulin, and KCL. So it does not specify Ringer's lactate. So I'm going to treat it as incompatible. So what I'm going to do first is I'm going to give a Preflush to my IV to make sure that I get rid of any excess Ringer's lactate in there so my medication doesn't mix. So we're going to stop our infusion. We'll take the port closest to our patient. And this medication is also a vesicant, so I would want to make sure that my IV is still in the vein and not gone interstitial. Okay. So I've got my 10 mLs pre-filled. Get the air bubbles out. Okay. And I'll kink that tubing. So I'm going to flush this tubing, getting all the Ringer's lactate out, and at the same time too, I can assess my patient's IV. Okay, so we'll give it a good flush. Luke, does that hurt at all? Luke says no, it doesn't feel painful. I don't see any bubbling, I don't see any leaking, it's not painful. And now I have my medication, and I'm going to administer it as per MAR. Okay, so when I read my PDM, it says IV push is not recommended. However, we're going to say that my patient needs this right away. He's at risk of seizures. So IV push, see the potential hazards. So I've reviewed those, and also I've looked at the maximum rate. So the maximum rate that I can give this is 50 milligrams per minute, and I have a 100 milligram dose. So I'm going to give this over 2 minutes. As my maximum rate, and also my maximum concentration is 50 milligrams per ml, and that's what I have in my syringe. So I'm not exceeding my maximum rate, and I'm not exceeding my maximum concentration. So I've done my calculation. If I have 2 mLs in here, which is my 100 milligrams, then I'm going to push this over 2 minutes. And so I can do 1 ml per 1 minute, or 0.5 ml per 30 seconds. So that's what I'm going to do. So I'm gonna make sure I can see my titrations. Okay. And I'm gonna push 0.5, and I'm gonna wait my 30 seconds. It's okay if that alarms, it's just because I've taken a little while, so we can just silence that. Go okay, and I'm waiting for my 30 seconds to elapse, so I'm watching the clock on the wall, or I'm looking at my watch. Okay, 30 seconds. Okay, then I'm going to push another 0.5 and wait 30 seconds again. So we're going nice and slow so that this medication will administer over 2 minutes. Again, 0.5, wait my 30 seconds, that's my pause time, and then after 30 seconds, push my last 0.5. Okay, and again, I'm still going to wait 30 seconds. I can get my flush ready to go. Okay, get the air bubbles out. And you'll remember that we flushed this IV tubing with a slow 3 mLs for our IV push. Okay, so I'm going to go nice and slow. So again, 0.5, wait for 30 seconds. 0.5, pause for 30 seconds. I'm going to do this for 3 mLs, and the reason for 3 mLs is because from this port to our patient is approximately 3 mLs. So I don't want to just push that dilantin in really quick. I want to do it slow as per my PDM. Okay, so once I've done 3 mLs, which on this syringe, since it was a 10 ml syringe, that will be 7 mLs. I have 7 mLs left in here. The medication has gone through my IV tubing. There is no more medication left in here, so I can just go ahead and flush that through. So that's a post-flush to create a buffer. So we know no medication is left in here. It's not going to mix with the incompatible solution of Ringer's lactate that's running. So we can go ahead and restart that IV. So it's running again. We can go ahead and do our hand hygiene, and we do our documentation.